Good afternoon and welcome to this COP26 Fringe event run by FutureCo Capital on health, tech and climate. I'm Greg Allen, I'm the Chief Executive of FutureCo Capital. We are a 70-year-old charity and our vision for the future is a fit-for-purpose health and care system that is experienced as fit for purpose by those in receipt of care. And at FutureCo Capital, we focus our work currently around 5 strategic pillars: data, technology, climate, innovation and investment. And we think that there's a very important link between climate and health. And there has been some really good work going on in this area. But there's been no dedicated health and care track at COP26. So I think this event is very timely. And what we aim to do today is to explore health and climate and technology and draw on the recent work and research of my organisation, FutureCo Capital, specifically our research with NHSX AI Lab, and within that, 2 pieces of research which explore the interaction between technology, climate, and health. Now, one of those pieces of research has already been published, and the second is to come. And my colleague, Dr. Peter Bloomfield, can talk to those shortly. And I think a couple of key questions for today are: what is the climate impact of tech development for health and care? And how can tech be used in health and care settings to reduce the impact on climate? We've got a great panel with us today, chaired by my colleague Peter Bloomfield. We've got Ryan Jenkinson from the Centre for Net Zero. We've got Leanne Summers from NHSX, and we've got Pete Clutton-Brock from Radiance International, and Ben Tung from NHS Digital. So I'm going to hand over now to Peter to start the debate.
Good afternoon, everyone. I'm just going to share the slides. Okay, so as Greg mentioned, we've been working with NHSX for a little while on this overall question of health, technology, and climate, and I'm really pleased to be able to present some of the research that we've been doing. And today, the presentation will largely focus on the stream of work we've been doing on artificial intelligence, and then the discussion will move on to be more broadly technology-based and the overall NHS and health and care system. Okay, so as I'm sure everyone is aware, COP26 is going on last week and this week, and Ryan and Pete are both up in Glasgow at COP26. So we're really lucky to have their expertise as part of this discussion. I think it's really interesting the sorts of commitments that have been made through COP26, and also thinking about how health both is and isn't part of the overall narrative. The impacts of climate change on health are really significant, and this systematic review of systematic reviews is a really interesting and useful piece of research to read. If you can't get the references off the slides, please do email me afterwards, and I'm very happy to share any of the resources as part of this pack. But as Greg mentioned, there's no dedicated track to health specifically at COP26. There's a WHO kind of fringe event or things happening on the margins of COP26, but it's slightly surprising that there's no specific negotiations or overall days dedicated purely to health and care. So this brings us on to the research itself, and we were looking at 2 different sides of this question. So we're thinking firstly about the sorts of solutions that are being developed in terms of artificial intelligence, both for climate and for health. So this diagram at the bottom is from the paper. So that's just segmenting healthcare provision, and then some of the sorts of technology being developed. Okay, super. So sorry about that, everyone in the audience. Not sure where the connection went there, but it looks like we're back online. So I was saying before that this systematic review of the different health implications of climate, I think it's a really interesting thing to consider that actually there are quite profound health implications of climate change, and as well as managing the improvements to health that technology can provide, we also need to think about how the technology developed to improve health might be having detrimental consequences. I'm not entirely sure where I cut out there, so I'll go quite quickly through this next bit. But I was just saying that it's interesting that there's no dedicated negotiation day or stream for health and care, but there are a few fringe events that people will have seen related to all of this. In the paper, we discussed some of the solutions that are being developed for healthcare, and also some of the solutions being developed for climate improvement. But this article by Simon is well worth taking a look at. And then on the right-hand side of this screen, taking a look at this anatomy of an AI system and the different areas. So whether it's data processing or hardware manufacture and precious resources and earth metals and things like that. And then this paper at the bottom from Struble and colleagues is probably the first paper that I became aware of that really demonstrated that there were quite significant consequences in a climate aspect to AI development. So in terms of the research that we did and this paper that we published, we segmented the clinical deployment domain and some of the areas that contribute to climate change. And it's really interesting. There's been a big focus on supply chains at COP26, but there are also other areas that are very crucial in the development of AI models that aren't really focused on so much. We found that there are some good opportunities as well as some concerns. In terms of the opportunities, there's not been a huge amount of practical deployment so far and a demonstration of the proposed ideas actually having the intended reductions as a follow-on. Similarly, in the concerns area, largely the research that we assessed is focused on natural language processing techniques and didn't really have uniformed approaches to reporting climate impacts. So there are quite a few considerations across healthcare in terms of how we quantify emissions, where those emissions are coming from. And particularly, a lot of the quantifications are related to computational resources and data processing. But as we've demonstrated through the figure on the left of the screen here, there's actually quite a lot outside of that that needs to be considered. So as the NHS is heading towards net zero, and hopefully the rest of health and care as a sector is going to join the NHS and head in that direction as well, there's quite a few things that we need to consider outside of what's published so far. So a few take-home messages. So firstly, there's some really great work happening as part of the NHS and alongside it. And that's both in terms of development of AI technology to improve care, but then there's also the net zero side of things, and some of the work that Ben will talk about in a little bit is really key to aligning these two different approaches. We need to be aware that what's reported in the media about artificial intelligence and climate both are often extremes, and we need to be a bit careful about how we interpret these different things and how things can be tested more accurately. And then we'll finish up with a bit of discussion about metrics and quantification and thinking about what else we need to do beyond carbon and net zero to truly make healthcare delivery climate friendly. There's a few other considerations here that we're looking at in the second phase of the research, which should be available early next year, but starting to think about the different types of technologies outside of artificial intelligence that contribute both in a positive way, and also there are some concerns around these technologies as well. But we're reviewing those actively and looking forward to sharing that in the future. So a few discussion points that we'll move on to in a minute. We've covered quite a few of these already, so I won't go over them again. But this last one around mechanisms for positive change is a really interesting one, so I think that will form the basis of a lot of our discussion. As we go through the discussion, please do put your questions into chat, and hopefully we'll have enough time at the end to go through them. But yeah, a really big thank you to the research team on this piece. So Emma and Cassandra have both moved on from NHSX AI Lab now. But Pete, we're very lucky to have with us today, and my colleague Josephine, who quite a few of you in the audience should know, was really helpful in getting the manuscript out and making sure that everything was done in a rigorous and robust way. So thank you very much, and we'll move to the discussion now. Stop sharing. Lovely. So I think to start off the discussion, what we'll do is if we could go through the panelists, and if you'd just like to introduce yourself and your background and some of the interests that you have in this space. I'll start with Ryan as you're first on my screen, and then we'll just go along with whoever's in order. So Ryan, take it away.
Hey, hopefully you can hear me okay. Hello from Glasgow. So yeah, thanks for inviting me to be on this panel. It's great to be here with other kind of really esteemed people. So my name's Ryan. I'm a data scientist for Octopus Energy's Centre for Net Zero. So we are a research lab leveraging data from Octopus Energy, which is 100% renewable energy supplier, and kind of their customers, to try and understand different decarbonisation strategies and ensure faster, fairer and more affordable paths to net zero. Before that, I was leading the data science efforts and AI model building and all that kind of thing for Hitachi on a commercial electric vehicle trial. So this was kind of helping partners like Uber, Royal Mail and Centrica, and helping them understand the transition from petrol and diesel vehicles over to electric. So that was not just about like actually purchasing those vehicles, but also how to kind of operate them. So we used a lot of kind of data science and AI modeling techniques to do things like modeling the charge point demand in London, as well as kind of making predictions for how the Royal Mail depot might kind of behave after it's electrified. And how it might even make some money by turning down its kind of depot demand at times when at peak times for consumers nearby to relieve some strain on the grid. So I've worked in AI for kind of several years now, and net zero for the past kind of couple of years. So I kind of continue to learn about how all these different kind of sectors operate, so like health and care today, and where they interact with each other. So I think just in terms of what I'm interested by, I think it is kind of grid electrification and net zero. That's what I spend most of my time kind of focusing on. And obviously I'm a data scientist, so I'm slightly biased, but I do think that AI is extremely important in kind of helping us get there, if not essential in certain parts of the decarbonisation journey. But I also kind of think that we shouldn't forget the power that kind of humans and kind of local communities and policymakers have in kind of enabling that transition. So I think no other sector kind of exemplifies that kind of human element more than the healthcare sector. So interested to kind of explore all those things today.
Thank you very much, Ryan. Really, really good introduction. Pete, over to you.
Thanks very much, and also hello from Glasgow. So I'm Pete Klettenbrock. I'm one of the co-authors of this paper. I'm CEO of Radiance International, which is a consultancy that focuses on working with big companies, mostly tech companies, on their climate strategies and programs. I also am one of the co-founders of something called the Centre for AI and Climate, which is an organization made up of data scientists and energy and climate change experts looking to support the adoption and application of AI and data science to climate-related challenges. So through that, we work with a range of policymakers, technology providers, businesses to accelerate the adoption. So I think there's lots of really interesting questions we can dig into today. I think I'm most focused perhaps on the positive applications of how we can use AI to advance the transition and accelerate the transition to net zero. But equally, I think it behoves all of us to think about all of the technologies that we use. We need to think about how we reduce the emissions associated with them, and that's sort of part of this paper as well. So great to be here, and it was great to work with Future Care Capital and NHSX on this project, and thanks for inviting me.
Lovely, thank you, Pete. And yeah, thank you for all your work on this project. It's been really valuable to us. Leanne, over to you.
Hi, Pete. Thanks for having me today. So I feel as though I'm an interloper a bit here. So I've only recently come into both the domains of AI and also looking at the climate impact. But this is something that's really, really important to me. I've worked in I've worked in NHSX sort of since it started, mainly focused on patient-facing digital services. I'm much more of a digital and health background sort of person. So I studied biomedical science and international health policy sort of in my career, but I'm really interested. In fact, for a long time in NHSX, my job title was digital ecosystem lead. So I love the idea of interdependencies and how we, manage, how we think a bit more holistically about what we're doing and bringing about change. So for me, I've recently moved into the role, taken over from Cassandra, who led on the commissioning of this paper, which I think is really, really important for us to get thinking about the strategy moving forward. So as we develop, kind of our vision is around developing what we're calling a learning health and social care system. So something that's continuously improving and data driven. But we need to have principles of, sustainability, ethics, as well as cost effectiveness, safety, all this kind of thing built into that. So really glad to be here today.
Lovely. Thank you very much, Leanne. And last but by no means least, Ben.
Yeah, hi everyone, and thanks for the invite to be on the panel today. So I'm here representing NHS Digital. So we design, develop and operate national IT and data services for the health system. I'm a full member of AIMA and a chartered environmentalist, and as sustainability lead subject matter expert at NHS Digital, I'm really working at the nexus of health and digital and sustainability or climate, as this session is framed. We've made some strong progress. You can check our stuff out on our external web pages if you want, but we, especially around our hosting arrangements, so made some really good solid progress in that area over the years. And we're currently working on our next 5-year strategy to really start moving through the gears and create our net zero roadmap, which is giving real detail to looking at how we're bringing the carbon footprint of our services down towards zero, but also where possible to use digital as an enabler for climate change mitigation, and as importantly, climate change resilience. So we're thinking about how our services can be resilient to the likely implications of climate change and how they can bring resilience to the health service as well. So I've been working very closely with NHSX and NHS England on the digital work stream of the NHS-wide net zero plan, the greener NHS plan. And I've got a bit to tell you about later in the session about some tooling that I'm trying to develop to get a better handle on how to do this and measure it.
Lovely. Thank you very much, Ben. And thank you everyone who's already putting questions in the chat. Please do keep them coming. We'll try and get through as many of them as possible. To start off, I think we'll go to Leanne to hear a little bit about the future strategy and understand a little bit more about where you particularly think that this work will be taken. So obviously this is, well, actually, I think it's the first paper that's been published linking artificial intelligence, health and climate as a kind of triangle. So it would be really interesting to hear a little bit more about how this might be being built into or built on for the future work.
Yeah, thanks, Pete. So the genesis of this paper is for us to be thinking about the impact of the technologies sort of as they become part and parcel of how we deliver health and care, to the nation. We obviously are in, I believe we're calling it a climate crisis. We have to think about the impact of the climate even on our health, the determinants of health. So, how might it affect our supply of water, even food? Are we going to have more tropical diseases in a country that's, temperate like the UK potentially? And what does that mean? So, we are living through a pandemic which is like nothing perhaps in any of our generations, in any of our lifetimes here. We've been living through that the last 18 months. Are there others to come? And this is, these factors are things that we need to be thinking about as we move forward. So, if we implement these technologies, one of the things that we really need to be cognizant of is that we're not introducing more harm. Now, as the paper alludes to, there's a balance there. Some of the technologies can help, make servers and things like that more efficient, or how the energy grid is pulled upon. We can make better decisions, but and so they might net out. But we just have to be cognizant that we are implementing technologies, and certainly the way that we measure the impact of the technologies that, digital technologies at the moment, we might be thinking about things like the fact that we've, online consultations most definitely have reduced the number of car journeys that people have taken. But, have we looked at the upside of that? What's the down chain supply chain issue of the implementation of those technologies? And we perhaps don't need to overly worry, but we definitely need to be cognizant of it, and that's what we want to do, make sure that we're doing moving forward. One of the things that the paper highlighted as well was the extent to which we measure the impact of the climate impact. So one of the things I know in feedback on some of the papers we've been developing them, we're looking, how do we quantify the impact of these technologies in a way that really translates to the general public? When it says 70 million carbon tons, and this is me not being familiar with the terminology myself, is it car journeys? What really translates? I don't even have a car, that doesn't translate to me. It's like more why I tap on my TfL card or something like that. So, that's just only a personal experience, but we really need to quantify these things. And we talk a lot in health about cost effectiveness. So, quality of life years gained, or disability adjusted life years gained. But have we factored in the environmental impact of that too? And I know that's something that Ben is starting to look at with NHS Digital. So in terms of what we're doing for the strategy, we are asking these questions, and that's what we need to continue to do to move forward. And we're also working with colleagues across NHSX, England Improvement, the whole alphabet soup of our organisations, to look at the how we can also implement this into the what good looks like framework. So for integrated care systems, how do we set some standards, or some operating procedures where people are almost given permission to think about this routinely, and what are the frameworks that we can use to do that.
Lovely, that's really interesting. And you mentioned some of the work that Ben's been doing, and I've been very lucky to see some of that work and be involved in some of his working groups and things. So Ben, I might come to you actually if you could describe a little bit more about your current streams of work, and particularly on the development of metrics and your minimum viable product for measurement and things like that.
Yeah, absolutely, a pleasure. So essentially what I've been trying to do is create a net gain calculation tool for the sustainability impact of digital health services. So in a nutshell, that's looking at offsetting the costs, in inverted commas, sustainability costs of running a tech stack which delivers a health service, against the enabled benefits that health service would deliver. So a simplistic example is telehealth. So that requires computers for the clinicians, and then the networks and data centers most likely, and end user devices for the patients. So there's a tech stack there to measure. But it will deliver travel savings, it will deliver estate space savings and associated energy and embodied carbon once it matures, local air pollution, paper reduction, a whole plethora of benefits there. So what I pulled together a group of health service ALBs, and other kind of thought leadership and research groups within the system to come together to build a methodology and principle of how to do this. It's a complicated process. So essentially, the kind of phase 1 version of this is looking at building a carbon tool for it, which we're currently in the sort of latter stages of development and internal testing at NHS Digital. There's a view to this being open sourced out to the sector once we're happy with it. And an early use case will be through government spending reviews, because they're starting to ask for net carbon impact and programs that are asking for money. Other interesting purposes for this kind of tooling are things like the technology code of practice. So that's another government thing. To get money for delivering digital things, you have to show that you're meeting it, and imminently it will have a sustainability principle in it. So having this kind of tooling in place alongside associated criteria sets, which we're building for sustainable digital service design criteria to evidence progress, should meet those kind of spend controls. And as importantly, green book requirements. So yet another government thing for business case writing, which says we should all be re-internalising environmental and social externalities into our business case options appraisals. A right mouthful, but basically taking people and the environment into account when we're deciding how we spend our money. So it's got loads of uses. It should be really useful, but it's super complicated. That's why we're focusing on carbon initially, but we'd love to take a broader view going into the long run. If you're interested in this kind of thing, take a look at integrated reporting methodologies. Capitals Coalition is great. Yorkshire Water have got fantastic examples of proper holistic ways of making business decisions that take into account all these factors. They've spent years developing it, and a lot of resources has gone into it. So it's not a simple task, but this is really where we need to get to. So in terms of key sustainability factors, there's obviously energy and carbon in the use phase for digital systems, but there's a whole load of embodied impacts as well. So be they water usage, pollution, rare earths, ethical supply chain issues. There's a plethora of things that we could be thinking about, and that's before we get properly into the kind of overlapping social sustainability stroke health space, which Leanne mentioned around qualies and things like that, which we can start to wrap up into these kind of decisions as well into the long run. And there's also overlaps into other digital service design principles as well. So interoperability, or are digital systems talking to each other, should drive out a plethora of efficiency benefits and patient experience benefits, including carbon reduction. And another one that's really relevant to NHS Digital is digital inclusion. So making sure we're designing services with backwards compatibility, so older citizen devices can be utilised to access services which will contribute to health equality. So there's a lot to think about in this space, and I think we're trying not to oversimplify it. But phase 1 is this MVP carbon tooling, which is really aiming to get us into a position where we can start to think about where we can create co-benefits between sustainability outcomes and other health service objectives, and where there are likely to be tensions and trade-offs, because they're the kinds of discussions that we need to get into. It's all well and good knowing what the sustainability implications of our decisions are, but really where there's a tension with another health service objective, that's where we have to have a properly evidenced discussion and decision, and a really transparent and repeatable process. I could go on, but I think that's probably a good place to pause.
I mean, there's so much rich information in all of that, and something I found as we've gone through this research is that there's so much out there that it's difficult to communicate the important parts to the right people at the right time. And there is actually a question in the chat that I want to put across to everyone at this stage, which is, so what methods for metrics do you suggest? I'm trying to work with a group of care homes to measure their scope 3, but it's difficult to choose which tool to use. Thank you. So this is someone from Plymouth University, the sustainability lead. And I think this really highlights a key issue where there's so much guidance out there that is quite tricky at times to interpret for your own use case or exactly what you're trying to do. And I think maybe Pete and Ben, if you can come back on that and say a little bit about your experience practically with Scope 3 and wider ways of measurement.
Well, I think it's a really good question, and it's certainly not an easy one to answer. And I think it's one that a lot of people are grappling with more and more. I think it's particularly an issue with digital because what we've seen over the last few years, especially, is that people are using cloud compute more and more, and they're moving from having their own servers to having servers in the cloud, which is actually moving their emissions from what were Scope 2 emissions to Scope 3, which actually increases the flexibility they have in terms of reporting on them. So I think that's definitely an issue going forward. I think in terms of the tools you can think about, and there is a lot of guidance out there, and I think the greenhouse gas protocol offers a lot of guidance on this in terms of how to report. It's worth digging into some of that, including the supply chain emissions process. They've got ICT specific guidance that it's worth checking out. It is quite detailed, it is quite complicated, but it's worth digging into. All of the various target setting processes, whether it's science-based target initiative, target setting processes, will have guidance again that you can dig into. I think when it comes specifically to compute emissions, it's not easy, partly because of the transparency issue. So it's not entirely clear the emissions that are associated with cloud compute. Often you've got providers such as Microsoft Azure who are going a bit further with their sustainability calculator, so that's worth checking out. But the other cloud compute providers, it's actually really hard to determine what the emissions associated from compute are. And I think actually that there's a big opportunity for the NHS in that point, because I think the NHS has a lot of procurement power in determining what digital providers it works with. And I think it could use that to help nudge some of these big digital providers to go a bit further and faster when it comes to the transparency issue, because transparency is actually one of the big topics at COP26, actually mostly related to the fact that countries have a varying degree of how much they want to be transparent about the emissions profiles they have and how they determine their inventories. But the same exact thing applies to companies and how they provide data. So I think when I've worked with tech companies, there's definitely been an element of encouraging them to use a pre-existing process, such as the Science-Based Target Initiative process or the CDP process, to make sure that they're being transparent about their emissions. I'm happy to provide more tools and tips offline, but that's probably a starter for 10.
That's great. Thanks, Pete. Before I come to you, Ben, directly, I might ask Leanne, what do you think about that? I guess the procurement stick from NHS and NHSX and digital.
I definitely think that's one of the levers that we have at our disposal, isn't it? The challenge is always, I mean, this is the point of us having standards, so that we can buy, we can set the tone of what we expect to purchase. So that they're definitely levers that we look at. Yeah, definitely.
Super, that's reassuring. And Ben, did you have any further thoughts for the person who asked the question?
Yeah, I mean, just in response to Pete, very, very briefly, I think there's already a lot of engagement going on with the hyperscalers to try and get a better idea of the kind of carbon footprint of their services, and trying to move towards normalizing it by business useful transactions and things like that, which would start to be able to get us into a position of be able to kind of rank performance across different services, which would be brilliant. It's partially coming from the Cross-Government Sustainable Tech Forum, acronym STAR, which is driving all of the departments to make those approaches. In terms of Scope 3, I think one thing that, I mean, there's lots of useful resources already thrown out there, but one thing that is starting to happen is detailed supplier engagement. So going to them with fairly simple surveys under more or less greenhouse gas protocol kind of categorization to say what is their revenue and carbon footprint, and then doing a simple revenue normalized carbon footprint for what each organization buys off them. It's still a bit of a simplistic calculation because it's not product level. The dream would be able to get into product level upstream Scope 3 carbon footprinting, but as we all know, that involves very, very thick reports of life cycle assessments and stuff like that, which is incredibly complicated. So it's a good halfway house, and that's what's starting to happen across the health sector, is this kind of revenue normalized supplier specific scope 3 footprinting, which is a fairly quick win, I think, to be honest.
Lovely, thank you. I hope some of those insights are useful, and the more than just the person who asked the question can make use of them in the audience. Ryan, I might come to you now and ask if you could explain a little bit more about some of the modelling projects that you have ongoing. We spoke about this a little while ago, and it sounded really interesting and potentially something that the health sector could start to adopt and consider.
Yeah, sure. So currently at the Oxford Energy Centre for Net Zero, we're doing a project around something called agent-based modelling, which might be familiar to some people on the panel, but just to kind of put it into context, it's where we, so an agent is where we take a kind of an entity, so that might be a person, but for us it's a household, because we're thinking about kind of energy usage. Then that agent will kind of make decisions as it interacts with its environment. So it might be for us using energy or deciding to purchase something. But I think what's important is that kind of each agent is different. So each household has different level of income. They live in differently sized houses, etc. And this kind of these differences between agents and measuring fairness, I guess, is also kind of quite important in healthcare as well. And I guess those differences mean that they make decisions differently, and we model for that kind of accordingly. So what we're doing specifically, and then I'll kind of link it back to healthcare, is for our simulation modeling, we're considering households making decisions about purchasing different low carbon technologies. So we're really measuring like low carbon technology uptake and adoption. So we're simulating these kind of key trigger events that causes people to change something like their heating system or buy an electric vehicle or something like that. So that might be their current heating system is breaking, or they've just moved house, or they're renovating, something like that. And there's different kind of interventions or kind of different levers we can control. So for us, that would be government policy. So for example, the £5,000 heat pump grant that people can apply for soon, that might be something we can input into the model and see how our agents interact in that scenario. But to link this back to healthcare, actually a lot of this work was, I don't want to say popularized, but kind of inspired by a lot of the COVID modeling. So in general, I think an agent-based model, if supported with kind of the right data, can be not necessarily more accurate, but perhaps more insightful than these like higher level dynamic models of like SEIR. So susceptible, exposed, infected, recovered modeling, because it can give a kind of coarser breakdown of maybe like for COVID, for example, in the transitions that humans go between environments, so between schools, places of work and stuff like that. And we can really start to understand that. And I think in general that this kind of approach, so agent-based modeling, would be really useful in healthcare settings to understand things like the occupancy rates of hospital beds and all that kind of thing. But also I think it's a kind of a tool for allowing you to ask these kind of what if questions. So what if kind of the virus were, or we would have like a stronger than usual kind of flu season, or decreased or increased staff numbers. And I guess all of being able to like run those different simulations would help in that kind of process thing that you discussed earlier, Peter, for healthcare. So the kind of pragmatic process and planning. But then also, I guess there's nothing to also stop you from when you run that simulation to also kind of check what the kind of climate impact would be as well from that specific scenario that you're kind of running. I think the only other interesting thing I kind of wanted to touch on just briefly was that in agent-based modeling, a kind of core component or pillar is that these agents can communicate between each other, and there's kind of interaction between them. So, for example, if you buy like you might be more likely to buy like an electric vehicle or something if your neighbor does or your family friend does, recommends it to you, in the same way that when you download that app on your phone, it's because someone recommended it to you. And I think that lots of people kind of rightfully take a lot of like pride in the NHS. Like a lot of studies have shown, like YouGov, it's like over kind of 87% of people kind of view the NHS as kind of being a leader in this, and it's really strong like local brand communication. So actually, a lot of the stuff that the NHS does on net zero can really impact these like local communities, and not only increase the kind of uptake of not only can they reduce their own carbon emissions, but actually it can actually kind of percolate out into those kind of local communities, if you will. So I think there is the pragmatic thing of yes, the kind of agent-based modeling stuff that we're trialing and exploring a little bit at Octopus could be used in healthcare. But also I think there's maybe some learnings from that actually this kind of agent interaction is also quite a powerful kind of stimulator and kind of galvanize a lot of these things. So that might be quite interesting as well.
I think that has a lot of potential benefits for healthcare. And Leanne and Ben, do you think that agent-based modeling is something that you guys would consider and be interested in using? Is anyone using it already in the climate space for healthcare?
I feel like Ben might have more examples. I definitely think it's something I'm very interested in exploring. Definitely, I don't know of any. I don't know of any yet.
Yeah, I mean, it's got a lot of potential. I'd certainly agree. I don't think we're at that level of granularity yet. One thing I didn't say about the tooling that I'm working on is one of the really big challenges that we've got in terms of building this kind of level of understanding is getting consistent input data to put into models, because it's the health service is obviously a collection of thousands and thousands of different organizations. So trying to get consistent approaches to the way that we're doing things is very complex, but it's certainly something to aim at.
So Ryan, how do you deal with data quality and getting enough data in the first place?
Yeah, I think it's really hard. And I think kind of Ben hit the nail on the head there around kind of consistency. So there's nothing to say that, say, one agent-based model that you build will have different parameters, I guess, that you can tweak. And so, for example, let's say just in the health and care setting, you run something and you want to maybe apply that across different hospitals. It would require getting the same kind of input data right across all of those different settings to be able to run it. And in a lot of places, and even in the work that we're doing, that kind of level of standardization is quite hard to kind of come across. So it's definitely not like a silver bullet, but for very specific kind of research questions or hypotheses or kind of specific questions you want to answer, you can collect data. And I guess it usually we start really small. So we figure out what it is that we want to answer specifically. So for us, it is about kind of heat pump adoption, for example, and we collect as much kind of open data on that as we can. And then the research phase usually takes quite a while, but then it kind of almost writes itself for that kind of for that use case. But yeah, definitely consistency and standardization is hard.
Super, thank you. I'm going to ask you one more question before I move on to our next question. But given the research that we've done has largely focused on kind of the positive and the negative of the technology and looking at those unintended consequences as well as the benefits, do you know how kind of climate impactful agent-based modeling is? I always thought it was a fairly computationally light approach, but I don't know specifically.
Yeah, it depends on how big the simulation is that you're running. So it could take anything from a couple of minutes or hours on a local laptop to kind of, I don't know, maybe even like a day or something in a data center. So I think some of the discussions that were happening earlier around the data center journey that the NHS has been on and moving things to the cloud, which under some measures is a lot more efficient. But I agree with Pete's other point around transparency of kind of how much carbon there is in the computation. I think the thing I would say is that if you are building like these agent-based models, then keeping the scope kind of narrow to the question is you want to focus is going to mean that you're going to reduce the amount of computational time, which I guess is generally better in terms of you're not kind of running lots of simulations. But the problem a little bit with agent-based models is that sometimes you want to trial lots and lots of different simulations, which means you kind of run the same thing multiple times. So there are ways to do that in the cloud where you can provision a computer and run several simulations on the same computer, but it can get up to the kind of several hours of computation time, which depending on where you look at it, it is kind of small fry compared to some of the big models that Google are running, but perhaps maybe a bit more intensive than something you might just run on your laptop, for example.
That's really useful. Thank you.
Peter, can I come in? So one of the approaches we have in the strategy, that we're proposing is to look at what we're calling pathway optimization, which will essentially surface problems which might be small enough in order for us to run some of these tests. Obviously, there's lots of caveats around the availability of data, whether or not standardized, but certainly across different sort of sectors within the NHS, there are, or therapy areas, let's say, within the NHS, pathways of care, there are more and more standardized bits of data available. So for instance, the medicines database has just been, there's a standard now which is enforced with an information standards notice. So it's kind of a requirement for FIRE protocols to be used for medicines data to be shared. So that does start to unlock potential possibilities, and obviously medicines is linked to supply chain, which might then be more relevant to some of the other conversations that have been happening at COP26. So I think we're on the cusp of some of this stuff being an option, but it's just about presenting it and then thinking about what the impact of the climate is, like either alongside or at least in addition to. I think getting that balance right is the slight challenge that we've got to navigate at the moment.
Thank you, Leanne. That was very useful. And tying a few of those bits together actually is, Pete, I know that you do quite a lot of work with those big cloud providers and different parts of the tech industry on this question specifically. And I was wondering if you could describe a little bit of how you work with those companies and some of the I suppose difficulties that you might face with them, and particularly I'm interested in the concept of greenwashing and people demonstrating changes that are not necessarily as beneficial as they're necessarily saying in press releases and things.
Really good question, and I think in a way the answer is in a way has strong parallels with the wider conversation at COP generally, because I think the cloud providers, like a lot of countries, are setting long-term targets. We've got net zero targets from all of the major tech companies, whether or not it's 2040 or 2030. But I think the response from a lot of campaigners, certainly when it comes to countries setting long-term net zero targets, is that they set these targets and they're all blah, 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 and they don't necessarily match up to the actions being happening on the ground. I think with the cloud providers, there has been a lot of action and they have made good progress, some faster than others. I think what we're seeing is them starting on, well, some of them have been on the climate journey for quite some time. Some of them are catching up and trying to do quite a lot quite quickly. So that there's a bit of a range if you look at the providers. I think greenwashing is definitely a real issue. I think that the main way of addressing it is really through transparency, which we talked about earlier. So again, there are these processes where companies can set targets through well-defined processes for companies, such as the Science-Based Target Initiative process, where there's a very clear understanding of what's expected. There's very clear short-term targets. They don't allow for very long-term net zero targets, so they require short-term action. So we don't need to necessarily reinvent the wheel when it comes to thinking about this within the NHS and tech. There are pre-established processes and good ones for doing that. I think it behoves all of us to think clearly about how to minimize the risk of greenwashing, and how we think about that is, and partly it's about transparency, partly it's also about having high standards. One of the big factors when it comes to the critique around greenwashing is the use of offsets. So I think making sure that when your organizations like the NHS are looking to work with digital providers and setting requirements for procurement, having quite high standards about not using tons of offsets is a really important way of doing that. So I think a lot of companies have taken a lot of slack, a lot of critique in the last few days around relying on cheap offsets to meet some of their targets. And I think they're starting to realize actually they're going to get held up for that, and they're not going to get any credit for their net zero targets as a result. So I think companies are also realizing that if they are laggards on climate change, there are strong publicity risks associated with doing so. And so I think as we move towards faster and faster progress on climate change, as the salience of climate change increases and the pressure increases for companies to take faster action, that pressure to make sure that you're at the cutting edge, that you're actually reducing your direct emissions and not just relying on offsets, is only going to increase. So I think there's a range of processes. I think tech companies are generally a little bit further ahead than a lot of companies. It should be easier for them to decarbonize. Ultimately, a lot of these companies rely on electricity from electricity grids, and that's a lot of the associated energy use. And so part of the answer to this question is that we need to decarbonize our electricity grids. And that's an ongoing process and a wider question. But there are definitely ways that they can also use their technology to help do things like that and help decarbonize the electricity grid. So yeah, there's a sort of two-way street that needs to exist between tech companies and providers, so that we can both address their own emissions, but also use their technology to help address wider emissions throughout our economies.
Thank you, Pete. And that reminds me a bit of something, Ryan, we were talking about the other day, comparing so Octopus has different approaches to domestic energy use and commercial energy use. Would you be able to describe a little bit about that? Because I think in combination with what Pete just said, and potentially some of the ways that healthcare is delivered in the home and then also in hospitals and other settings, I think it'd be quite interesting to hear more detail on that.
Yeah, so Octopus Energy is supplies like residential houses. There is a kind of sub part of the group, so Octopus Energy for Business, that specifically works with a lot of the kind of business tariffs. I think, well, I don't know too much about the business stuff, at least I think Octopus Energy, what it's definitely known for is trialing some quite innovative tariffs for houses. So first of all, it is 100% renewable energy. So that is, I suppose, one of the unique selling points. I know there's a lot of different providers that do that now, but I think some of the other things that it does have specific tariffs for people who are doing for people who have electric vehicles, but also they have a kind of 30-minute by 30-minute tariff, where instead of just paying a fixed rate for your energy, it actually changes depending on whether or not the sun is shining and the wind is blowing. So that's called the Agile Tariff. And you can kind of sign up to that if you're a consumer. I think for businesses, Octopus Energy does work with businesses because they have kind of maybe quite different needs from a kind of regular, just kind of residential consumer. So that might be that they might work with certain companies. So like, for example, Arsenal Football Club, the Emirates, to help them kind of install a kind of battery and kind of use that as part of their total kind of energy management system. So they might kind of charge up the battery when energy is cheap and use it during peak times to reduce kind of strain on the grid. And I think there's loads of other kind of different things that they do with businesses. I don't know if that was
that's really useful. I think some of those approaches could definitely be well applied to healthcare. We're rapidly running out of time, so I'm just going to ask one more quick question to Leanne. When you were talking earlier, it sounded like some of this climate work and things around environment and energy and efficiency of technology might be worked back into things like the data strategy and the AI strategy. I know there have been a few different discussions on this. Is there anything you can tell us at this stage, or do we need to be patient and wait until next year?
I think this is part of our living conversation. So I think that it's already being factored in. The paper that's been published here is informing work that we're doing, and obviously, Peter, we're still working together on a paper. In the short term, I think that the outcomes will be seen more in what good looks like, which is a document that goes out. It's mainly aimed at regions and localities. About essentially, it does what it says on the tin: what good looks like for good leadership for integrated care systems, which incorporates digital and it incorporates sustainability. So we work very closely with Ben. So in the NHS Digital, NHSX is a blend of NHS England and Improvement and the Department of Health and Social Care. So we socialise that work and then link in with the Greener NHS team as well. So this is an active part of our conversation. So hopefully that, I don't know, allays any fears. It's why we're here today.
Yeah, that's really good to hear. And thank you, panelists, for joining us. And anyone who's submitted a question, I know there's a couple we haven't got to. So I'll address those offline. But all that's left is to hand over to Greg to close up. So thank you, everyone.
Thanks, Peter, and thanks all of you. It's been a fascinating and relevant debate, very timely, I think, today. Thank you to the panelists for your insight and to Peter for chairing. And thanks everyone for attending the event today. Apologies for some of the technical issues momentarily at the beginning, but throughout the discussion, I think it held firm. So that was good on the tech front. In terms of moving forward, just before we close the event today, I would urge you and encourage you to look out for and sign up to our future events, including our next event, which is on the 14th of December, as it says on the slide there. That's on residential care, tech and transformation. And that's on the back of our programme of research. It's in fact on the back of a series of other events around home care tech, mental health tech, learning disabilities, care tech as well. So all that remains is for me to say thank you very much for joining us today, and we'll see you next time.